Thank you for joining us. I am Ahniwake Rose, the Executive Director of the Oklahoma Policy Institute. During the last 2 months, our policy team has been looking at state and federal policies that impact Oklahoma during this national health emergency. Among the issues we have elevated is the importance of childcare. Today, I am joined by our Education Policy Analyst, Rebecca Fine, to answer questions we've been hearing from you. Welcome, Rebecca.
Thanks.
I'm wondering if you can first off just tell us a little bit about why childcare is and should be an important issue in Oklahoma.
Childcare is really foundational to our state's economy. Without childcare, parents can't work. And in Oklahoma, 2/3 of children need childcare so their parents can go to their jobs. So without a childcare industry, we really don't have the foundation of our economy. And the industry itself is also an important economic driver. So it pumps in over $900 million into the economy each year and provides over 20,000 jobs. Childcare is also really important for children. We know that high quality early childhood education is essential so that children are ready for school, and it even has positive impact on children throughout their life.
Thank you. So what programs are available to parents or for caregivers to help them pay for childcare?
In Oklahoma, we have a child care subsidy program, and this helps low-income working families, families who are in job training programs or in school, pay for all or some of their child care. So parents who are at or below the federal poverty line don't have to pay for childcare through the child care subsidy program, and families who make up to 85% of the state median income pay a co-payment based on their family size and their monthly income. And then childcare providers are reimbursed based on the quality rating of their childcare facility. And this program is largely paid for through a grant from the federal government.
So how has the pandemic impacted the childcare industry in Oklahoma?
The pandemic has had a huge impact on childcare providers in Oklahoma. Over 1/3 of childcare providers have been forced to temporarily close, and estimates show that 60% of childcare providers are at risk of permanently closing. Facilities who have had to close temporarily have, of course, had trouble paying rent and meeting their fixed costs. And even those who have stayed open have struggled with low attendance. So they've also had trouble covering their fixed expenses every month. Childcare providers have also had trouble getting food at times and cleaning supplies and medical supplies that they need to follow all the new guidelines. So it's had a really huge impact on providers.
So given all of that, what has the state and federal government done to help assist these childcare providers?
So in the CARES Act, the federal government dedicated $3.5 billion to support childcare subsidy programs across the nation, and Oklahoma got about $50 million. Our Oklahoma Department of Human Services has the authority to decide how to use this funding. And so far, they've dedicated the vast majority of the funding to help families through this time. So they've refunded co-payments that families paid for March and April. And they've also agreed to pay for 60 days of childcare for those who are looking for work and have lost jobs due to COVID-19. They've also recently set up a program called CIF, which pays family members to provide in-home care to children of essential workers. And they've also done a little bit for providers. They've given them a small reimbursement for the month of March, just paying them additional days for kids who are absent. And they have also increased the per child reimbursement rate by about $5 per day.
So that's obviously not everything that we need to do. What more do you think that we need to do to stabilize the childcare industry in Oklahoma?
It's not. So much more is needed, and the vast majority of help is needed by providers. They really need financial assistance and financial support to help cover their costs during low attendance and to make sure that they can reopen. So many of other states have used the federal money that they got through the CARES Act to help reimburse providers in a number of different ways. Some have given them reimbursement based on the number of students enrolled rather than the number of days students attend each month. That's one thing we could do here in Oklahoma. And we can also give out grants to help cover their operational costs. So to help buy cleaning supplies, to help cover their rent. And those are things that we could do here in Oklahoma as well. Advocates across the country are also advocating that we have additional federal funding provided through the HEROES Act, which is the next big stimulus package we're hoping gets passed by the federal government. They've allotted $7 billion for the child care subsidy program, but advocates are asking for $50 billion, which is much closer to the estimates needed to stabilize the childcare industry across the country. And certainly we need that to help stabilize childcare in Oklahoma.
Thank you, Rebecca. And thank you to everyone who sent questions to us about this topic. I encourage you to stay engaged in our work by following us on social media or by signing up for any of our email alerts. And as always, if you would like to financially support our organization or to learn more ways that you can support us, please visit okpolicy.org/donate. Thank you.